If you're at least 18 years old, if you have a high school diploma or a GED, if you have a laptop computer, if you have no money for college but are looking for a job that you can do potentially from home, and are interested in a career in healthcare, but you don't have the time, the money, or the will to study medicine or any other career in that field, then you've got to hear what I have to say. Hi, I'm Dr. C.H. Morgan, and I'm a general practitioner with over 10 years of experience in several healthcare settings, including ER medicine and medical scribing. And I'm here to help you jumpstart your career in the ever-growing healthcare industry. If you think that you can't do it, let me tell you, anyone can do it. If you have a high school diploma, as I said in the beginning, or a GED, you are capable of getting a career in the healthcare industry. But first of all, let's tackle some myths that you might have heard about healthcare jobs that are simply not true. Myth number 1. You need to go to college and have a medical degree, as in be a physician or a physician assistant or a medical assistant, a resident nurse, etc., to work in healthcare. Well, what if I told you that you can actually start building a career with just your high school diploma or a GED, or even neither of these, and make as much as $50,000 to $60,000 a year just on what I will show you on this video, or we'll be talking about on this video? Well, there are several areas in the healthcare industry that can be a good fit for you, and that requires some training and some investment, but are definitely not as expensive as a medical degree, as a physician, as a RN, or any other of these degrees that you might have to go to school for as much as 8 years to get. And I'll get into that a bit later, but trust me, where there's a will, there's a way, and you that are seeing this video today can have a career in the healthcare industry if you so desire it. Myth number 2. It's hard to get a career or a job in the healthcare industry. Well, let me tell you nothing further from the truth. There are plenty of jobs out there. There are many that are good paying jobs, I've seen as much as $80,000 a year for someone, again, that has only a high school diploma or a GED, or in some cases, they don't even ask for these, and you can still have a career in the healthcare industry. But there's a shortage of willing and capacitated people to fill these positions. And again, I'm not talking about doctors or nurses, although there are literally hundreds of offers daily for them too. The world's population is aging, and we will need skilled people to help tend to this aging population, and that's where you potentially come in. Myth number 3. I need to live in the US or Canada to work in healthcare. Well, this is simply not true. I don't personally live in US or Canada at this time, but I have and am working with US-based healthcare companies currently. So if I can do this online, you can do this online. Having said that, it is true that the salary and offers vary much from people who actually live in the US or Canada, but you can still work from anywhere in the world. You just have to put your mind to it and put the hours in so you can have a steady income and a steady job in the US or the Canadian healthcare industries. However, and this is a big one, I will have to make a disclaimer before going any further. This is not necessarily for everyone. If you want me to talk about a get-rich-quick scheme, this ain't it. Because there is some training involved and you have to be willing to work for it. But if you want this, you can have it. If you want to work and have a career and possibly a source of income for years to come, then you should listen carefully. You need to consider your options, and you need to think that if this is for you, you will have to work for it. So having said that, we're going to discuss 3 jobs that you can start right now, this year. Get on track to have a career in the healthcare industry if you so desire. And I'm talking about 3 current high demand jobs that you can start with just your high school diploma or a GED. Number 1, medical scribing. Number 2, medical coding. And number 3, medical billing. I know that sounds boring. I know that sounds mundane, but listen to me. There are jobs out there. There are plenty of jobs. And if you're looking for something that can be rewarding, at the same time be a full-time job and make a career out of it, then these 3 are the ones for you. Now, The three are similar, but each of these have different functions, so let's talk about them a bit. A medical scribe is a person who helps medical staff record a clinical encounter with a patient during a doctor's visit. This person would go in with the medical professional and be in charge of updating the patient's medical chart. This includes his medical history, current treatments, etc., and help the medical professional with all the transcription aspects of this visit. The medical coder, on the other hand, takes this information and assigns medical codes based on something called the ICD-10, which is essentially a long list of letters and numbers that codify a medical encounter. And everything, and I do mean everything, must be registered under an official ICD-10 code. Why? Because for legal and insurance purposes, that's how medical practices are evaluated, paid, and relate to insurance companies through the ICD-10 code. A medical biller then takes these codes and fills out a claim for the insurance company so that the medical practice can get paid. And that's how, essentially, in a nutshell, the medical system works, the healthcare system works. It's not a perfect system by any means, but that's how you can get started with a career in the healthcare industry this year if you so please, if you so want it, if you are willing to invest in yourself to get there. So yeah, that's a brief summary of how you can potentially begin to have a career in the healthcare industry as early as this year. But be sure to follow me on this channel, this YouTube channel, and like and subscribe and click on notifications because I'll be covering more on this topic and other topics in my upcoming videos.